Hello, my name is Cindy Davis, and I'm the President and CEO for Lakeridge Health. And I'm joined today by our Chief of Staff, Dr. Randy Wax. Randy is an internal medicine physician, critical care, and emergency medicine physician. And today we're going to talk about exciting news that's been happening throughout Lakeridge Health.
Thanks, Cindy. Let me tell you, I'm really excited about celebrating the anniversary of the first cohort of our Queens Lakeridge Health MD Family Medicine program. And so for those that don't know, this is a first of its kind program in Canada that actually created an education program where we brought in medical students who are dedicated towards becoming family physicians when they're done. In Durham Region, we have tens of thousands of people who do not have family physicians. And in Ontario, it's in the millions. And so this has been a problem that's been troubling the healthcare system for many, many years, and really excited that here in Durham Region, Lakeridge Health has partnered with Queens to have this program up and running. And what's amazing about this, this has actually received national coverage. It's important to recognize, Lakeridge Health and Durham Region has been involved in medical education and health professional education for many, many years. What's really special about this is that when medical students go into medical school, they're really undifferentiated. And so we know that because of some of the challenges in providing primary care in Ontario and across Canada, many of these medical students choose not to go into family medicine. It's been a big problem. And so what's really exciting about this program is it's totally dedicated towards teaching people how to be great family physicians when they're done. So we're providing them a strong education, not just the undergraduate medical student part, but it's integrated in what's called postgraduate medical education or residency. So once they join the program, they know there's an automatic spot for them here in Durham Region to learn how to be a family physician. But we also know that where people train is one of the most important predictors of where they end up working. And so being able to train the future family physicians here in Durham Region means that we expect that many of them will choose to stay. And Durham Region is a great place to live and a great place to work. So having the students come here and be part of Durham Region from day one and be part of Lakeridge Health means that we're going to have a great chance of helping to address that family physician shortage.
When we think about what it means to be with Queen's University as we develop that, I often think about universities and traditional medical schools, but how did that partnership happen, and what were some of the things in place that allowed it to so quickly get up and running at Lakeridge Health?
And I would emphasize it was quick because we are first out of the gate. We're the first partnership with a hospital and medical school like this, and we're the first medical school with Queens to get a dedicated family medicine program like this up in Ontario and across Canada. So it's pretty unique. So how did we get there so fast? We are the number one biggest place for medical learners for Queen's University to go outside of Kingston. We've been increasing the profile and the extent to which medical students do their training here at Lakeridge Health and in Durham Region, and that's been happening for many years, whether it's family medicine residents, because we've had a well-established family medicine training program here for over 10 years, just for residents, not for medical students. And many specialty residents have come here as well to train over many years. Our involvement in education really gives us that edge so that we can continue to do new things, continue to provide expanded services in Durham Region. This has always been a vision for us. And so we had the right infrastructure. We had many teachers here at Lakeridge Health who are already working with Queens, so they were ready to go and help out with the program. And I think a lot of the work that we've done as part of an integrated system of care with our family physicians in the community, and we continue to build those relationships, that's actually been very important because it's that relationship between Lakeridge Health and our family physicians and primary care providers that's really allowed us to set the stage for this. Because Lakeridge Health is a very important piece of this. And a lot of the training that happens is in the hospital, in the Learn Center. But we also are working with our family physicians and primary care clinics outside the hospital. And so that partnership is incredibly important. And that's very unique.
Randy, it sounds like a lot of things came together to actually support this program to get started so quickly. You've mentioned the Learn Center. So tell us about what the Learn Center is and what's in that location.
Thanks. No, that's great. Very proud of the Learn Center. So for people to know, it's actually spelt LHEARN, which stands for the Lakeridge Health Education and Research Network. So somebody was very clever when they came up with that many years ago. And it's actually a physical space in the hospital. And it's about 25,000 square feet of education space. And so it's a state-of-the-art center with huge auditorium, multiple large and small classrooms. And what's really exciting are our simulation laboratories, high fidelity simulations. So just like, the airline industry trains their pilots and they get to practice, different emergencies or other skills that they need to do. We have that kind of simulation technology here at Lakeridge Health. And what's great is it's adjacent to the rest of the hospital, so they can actually go out and see patients and really be integrated within the hospital as a clinical space, in addition to all the work that they're doing outside the hospital walls.
It's really exciting because we hear a lot, certainly you and I do, about the challenges our system has. And this sounds like a great solution in terms of how we can address the family physician shortage. But as we're building integrated care systems, it's really exciting. So when you think about our future with this program and with academic development at Lakeridge Health, what else do you see on the horizon for us?
The first thing is that it's not just family physicians. All across the health system, in all different healthcare professions, we have huge challenges in having enough staff. We're very lucky that not only do we have the partnership with Queen's University, but we have the partnership locally with Durham College, Ontario Tech University, to bring in phenomenal nursing and other students that come into the organization to learn. So I think we definitely are going to need to build on that. And the future of education and healthcare is the same as the future of just healthcare, which is it's interprofessional. And so not only we're going to have medical students here and becoming residents and learning to be physicians to work, but we have nurses, respiratory therapists, pharmacists, dietitians, and information technology people. There's lots of people that need to make a healthcare system function. And so for people to be able to function, to work well as a team, they need to learn as a team. And so I think we're going to continue to develop on all sorts of fronts the education that's happening here, so that we're covering the entire spectrum of healthcare careers for people in Durham region. The other thing I'd say is it's not just about the education. So along with education, we think about research and innovation. And so partnered with that, we're really expanding a lot of the research work that we're doing as well. And so looking at what's cutting edge technology for healthcare, how do we not only take advantage of new knowledge, how do we create new knowledge? And that also helps us attract the best and the brightest healthcare professionals who have an interest in teaching and in research as well. And so I think our future at Lakeridge Health is very bright. Our future in Durham region is very bright. And I think, tying that to the future of healthcare and the future of healthcare education, research, innovation is a key strategy for us at Lakeridge Health.
Well, Randy, that's pretty inspiring. As I'm listening to you, all I can feel is proud about this organization, the people that work in it. And what you talk about in terms of what's been accomplished and what we see as our future really is innovative, creative. But I think it speaks to the work that we do around partnering wherever we can. And what I heard throughout your comments was really this has been successful because of all those partnerships. The things that we had in our organization, our community partners, and absolutely Queen's Medical School, and their willingness to do this with us as we embarked on something brand new, first of its kind in Canada. I just want to say a huge thank you to everybody in our organization who made this possible. Your hard work and dedication really is setting the stage not only for Lakeridge Health and Queen's University, but Durham region and really Ontario and Canada. We've seen so many other reach outs to us around what we're doing here and what it's about. So I just want to do a huge shout out to the students. Congratulations. We're so glad that you've started this journey with us. We're so happy to have you with us. I also want to extend thanks to Queen's, all of the people at Queen's who really made this happen in terms of the tremendous amount of work that started this program to begin in September of this past year. And then the other pieces around our community partners, and we talked about it, what will ultimately make us successful for improving primary care throughout the Durham region is really those partnerships. And what we've seen is communities, municipalities, and really the region stepping up to engage with the students and with the university as we've gone down this path together. So I feel nothing but proud and inspired about what our future is going to be about. So if you'd like to learn more about the Queen's Lakeridge Health MD Family Medicine Program, please check out our website. You can also follow us on all of our social media connections, and we'd love for you to subscribe to our YouTube channel.